I'm coming from Croatia, where I work as a physician in an ambulance service. And before I start the lecture, I'll ask you a favor. Let me just figure this thing out. Okay. So if everyone who has a device, a medical device with you at the moment, could you raise your hand? So 2 of you have a pocket mask. So if you have something similar, so a few of you have a medical device. Okay. Thank you. We'll get back to that later. So moving on with the lecture. So you know, of course, everybody knows about the chain of survival, and that it is a sequential series of actions which will lead to somebody surviving a cardiac arrest. And of course, if we want to improve survival rates, we need to strengthen each link in the chain. And anything which can help us do that is really very well welcomed. And I'm going to show you how actually mobile phones and mobile technology can help us strengthen these links. So we can start, of course, with the first link, which says that we need to recognize signs and symptoms early and quickly call for help. Of course, if you want to recognize something, you need to be educated. And you can use one of such nice applications on your mobile phone to educate yourself. This is one application from the American Heart Association, which teaches you all first aid skills, among them, of course, also CPR. But not just to read about CPR, but you also can have really nice, beautiful, high-quality videos which you can have with you all the time in your pocket as a reference. And not just to use them prior to an emergency, you can use this in an emergency. There are several examples of people using this in an emergency to help themselves or help others. This is an American journalist who actually saved his own life after he was stuck underneath a building after the Haiti earthquake. So he used the application to stop his severe bleeding, because otherwise he wouldn't know how to use that. Okay, so now you of course know that something is going on. You need to alert your local emergency service. And we forget how it was 20, 30 years ago, because now everybody has a mobile phone. You know, and people are calling us from the woods, from top of the mountains. It's very easy to do so now. And they are calling us more and more from mobile phones. Just look at this example from London Ambulance Service. In 1999, only 5% of all the calls they received came from mobile phones, while in 2004, a third of the calls came from mobile phones. Today, these numbers are even up to 70%. And in my ambulance service, these numbers are really high for example, trauma and cardiac arrest calls. If you ask these people, and they surveyed these 30% of people, of course 72% of them said yes. In that situation, if we didn't have a phone, it would have taken us a longer time to contact you. And if you add GPS location, because when somebody is calling you on a mobile phone, you can trace it. And if you add GPS location and send this information to your ambulance crew, this all results in even faster response times. And of course, the faster response times will lead to higher survival. Something really nice, something new, which you can do on other networks we have in the developed world, is video calling. And the question is, could we benefit from video calling? So the first question, would our dispatchers be able to assess the situation in the scene better? Yes, it seems so that they would understand the situation better if they can see also what is going on. Would they be able to assess if somebody is breathing via video? It seems also that if the conditions are good, that even shallow breathing can be detected. Okay, so now they detected that the person is not breathing, they need to provide CPR instructions. So the question is, would this benefit those who are there to perform better CPR? And it seems that the groups who receive video instructions versus only audio instructions, that they do better chest compressions and that they are better at rescue breathing. So this is something promising, this is something coming in the future definitely, and we should look at this and change the protocols for the future. Okay, but unfortunately the arrest has happened and we need to provide early CPR. We need to provide not only CPR, but we need to provide good quality CPR. And this is really hard to do. This is even hard to do for professionals, yet alone for lay people. But you know, if you have something like this on your phone, if your phone can do something like this, it means that it has an accelerometer built inside. And an accelerometer is a device which can track movement. So why wouldn't this device track your movements of your hands while you do chest compressions? And I had this idea, and then I designed this application for a phone, you see here a mobile phone. I need to click on this, but the mouse is not clicking. Could you click maybe on the video, please? Okay. So the phone is giving you a metronome sound, a beat, which is leading you on 100 times a minute. And while you're doing it, it's counting your compression, it's giving you feedback on the depth, it's giving you feedback on the rate of compressions. So you know if you're doing it correctly or not. So you can adjust your actions. It also does other really interesting advanced stuff like give you ventilation modes, like also allowing you debriefing so you can prepare better for your next resuscitation. But I was wondering, you know, performing chest compressions is already difficult as it is, you know, this really unnatural hands position is difficult. And if I add something in your hand, underneath your hand, on top of your hand, I'm making this situation even worse. So I came up with a cradle, sort of a holder, in this case of a phone, but it can be any device for CPR feedback. And this cradle holder allows you to, can you play this video too, please? Allows you to keep your hands in a natural position while you perform chest compressions. So your hands are like in line with your shoulders. And we did a study and it showed that people are getting tired less quickly, they report less pain in the joints, they perform deeper chest compressions, and of course in combination with the CPR feedback device they are performing much better chest compressions. Okay, moving on to early defibrillation. Of course, mobile phones still don't defibrillate, but these things do defibrillate, and these things are all around us, of course, as you know. I mean, at least in some developed countries. But what is an AED good for if I don't know where it is? If I'm doing resuscitation here, and I don't know that it is like 2 blocks away from me, it's not useful for me. So can a mobile phone help me find an AED when I need it? Of course it can, because my mobile phone has GPS, it has a digital compass, it has beautiful maps, but it has also something else. It has this type of application called augmented reality application. Again, the video, please, is on the picture, just play the video. Okay, so what I do, I bring my phone like this towards the horizon, and I see the world, I see reality in its camera, but I see also, as I turn, I see these dots. This is a layer of dots. These dots are actually AEDs in space around me. And the application is showing me where they are and how far away from me they are. And if I keep running with my phone, the picture updates and I'm just following the dot. And I'm very quick to find the AED without knowing any streets, without reading any maps. So I'm really quick there to find an AED, get back and deliver this shock very quickly. Another interesting project in this link is a project from the Netherlands called AED Alert Project. So what happens is, you see the first circle up there. So the heart is a cardiac arrest case. So the dispatcher receives a call, which he suspects is a cardiac arrest call. Of course, he immediately sends ambulances there, but he also writes the address in the computer system. And what the computer system does then is it searches for volunteers in the area around this arrest, searches for BLS volunteers. When he finds the computer system these volunteers, it all happens in seconds, it sends them an SMS and tells them, okay, there is a resuscitation in that street, go and help. It also, at the same time, finds AEDs in the same area and finds volunteers who know how to use them around these AEDs. It sends them a different SMS. It sends them an SMS, go grab an AED in that street, and then go in that street because there is a resuscitation there. So they are using a lot of mobile technology here to connect the victim, the lay rescuers, and professionals. And they are really good, doing a good job. They are really good, their results are awesome. Okay, and finally we are moving to post-resuscitation care. Of course, there are a lot of things you can do in post-resuscitation care. One of the things you would normally do is record a 12-lead EKG. But you can then use your mobile phone or your mobile network to transmit this EKG wherever you like, to, of course, a hospital. And then this hospital can also send this EKG to a attending physician on his mobile phone. So he can be at home, he can be in the cath lab or whatever he is doing. He can review the EKG on the phone, and then he can again communicate via mobile network to you, or communicate via video calls so he can see the patient and receive real-time data on vital signs, real-time. So he can see the beat on the EKG at the moment you see the beat at the EKG. So he can give you really advanced instructions instructions and what to do with the patient. He could maybe give you instructions to give some drugs, which can be really complicated. So you can use, again, some applications on the mobile phone to help you not make a mistake. You know, they are very, very useful calculators for you to use. So this is a short overview, and we are like proposing a new chain of survival, a mobile chain of survival, because as I showed you, mobile phones can help us to strengthen each link, to educate us as a great educational tool, but also help us in real emergency. So I'm hoping that if I ask you the same question from before, that all of you will say, yes, I have a medical device in my pocket, because actually a mobile phone is a medical device, and it will be so more in the future. Thank you.